In the last video, we talked about what endometriosis is, the invisible condition that affects 1 in 10 women worldwide. But what's actually being done to stop the suffering? The good news, across the world, women are finally being heard. Governments, scientists, and advocacy groups are taking bold steps to bring this disease out of the shadows. So today, let's talk about what measures, medical, social, and political, are being taken to curb endometriosis. For decades, endometriosis was the disease no one talked about. But thanks to awareness campaigns and social media, the silence is breaking. March is now recognized globally as Endometriosis Awareness Month, a time when countries light up landmarks in yellow, host walks, and share real stories. Non-profits like the Endometriosis Foundation of America, Endo UK, and World Endometriosis Society have launched massive awareness drives. Their goal? Educate, advocate, and fund research, because awareness is the first step toward better treatment. Science is catching up, fast. Researchers have uncovered that endometriosis is not just a reproductive disease. It's a complex, systemic condition involving the immune system, hormones, and inflammation. New studies are exploring genetic links, showing that it can run in families. Others are identifying biomarkers, molecules in blood or tissue that could help detect endometriosis earlier, without surgery. In 2024, scientists in Europe tested a non-invasive saliva test that showed promise for early diagnosis. Imagine being diagnosed with a simple test instead of waiting years for surgery. That's where science is headed. The treatment landscape is also evolving. Doctors now use a multidisciplinary approach, combining gynecology, pain management, nutrition, and mental health. New medications called GnRH antagonists, like elagolix and relugolix, help suppress estrogen without the harsh side effects of older drugs. Surgeons are refining laparoscopic excision techniques, removing endo lesions with more precision and fewer complications. And researchers are studying stem cell therapy and immune-targeted drugs to stop the abnormal growths from returning. The focus is shifting from just managing pain to restoring quality of life. Another crucial measure, education. Doctors and teachers are being trained to recognize the early signs. Because endometriosis often starts during the teenage years, early intervention matters. Schools in countries like Australia and the UK now include menstrual health education in their curriculum. Girls are taught that chronic pain isn't normal and that seeking help early can make all the difference. In Africa, the conversation is growing too, especially here in Kenya. Organizations like the Endometriosis Foundation of Kenya, Kenyatta National Hospital, and several women's advocacy groups have stepped forward to create awareness and train medical staff. Local gynecologists are now working with international partners to improve diagnostic access, including affordable laparoscopic procedures. In 2023, Kenya joined other nations in observing Endometriosis Awareness Month, with marches, TV interviews, and medical outreach programs. The message was clear: no woman should suffer in silence. Even county hospitals are beginning to include menstrual health education in community programs. A small step, but a vital one. The digital era is also helping. Apps like Flow, Clue, and Endo Empowered now let women track symptoms and pain patterns to help doctors identify possible endometriosis earlier. Online communities have become safe spaces for sharing experiences, breaking the shame and stigma around reproductive pain. Because sometimes, knowing you're not alone is the strongest medicine. Governments are also stepping up. Countries like France and the UK have announced national endometriosis strategies, funding specialized clinics and research centers. The World Health Organization has recognized menstrual disorders, including endometriosis, as a global public health issue. In Kenya, policymakers are slowly pushing for better inclusion of menstrual health in reproductive policies and NHIF coverage for surgical treatments. It's a long journey, but the direction is right, from ignorance to action. The fight against endometriosis is no longer in the dark. More women are being believed. More research is being funded. More doctors are learning what to look for. And more young girls are growing up knowing that their pain has a name and that it can be treated. Science, awareness, and empathy are joining hands to change the story. The goal is clear: no more silent suffering. Endometriosis is not rare. It's just rarely talked about. Let's keep the conversation alive. Share this video, tag someone who needs to hear it, and keep demanding better care, more funding, and faster diagnosis. Because awareness doesn't just change minds, it saves lives.